Mental illness is a condition that affects a person's thinking, feeling, or mood. There are so many types of mental illness, and mental illness can be treated using both pharmacological and therapeutic means. When a doctor diagnoses a patient to have a mental issue, he will devise a care plan to manage the mental illness. Um, I'm gonna talk about schizophrenia, depression, and bipolar disorder. There are so many antipsychotics that can be used to treat schizophrenia, and sometimes this treatment is just to reduce the symptoms because schizophrenia cannot be healed completely. We can use antipsychotics and antidepressants to treat both schizophrenia, depression, and bipolar disorder. Some antidepressants like Elavil, Anapramil, Tofranil, Pamelol, Nadil can help people suffering from depression to heal. Some schizophrenia patients can be prescribed chlorpromazine, flufenazine, haloperidol, lithium, lozapine. And if they are given these antipsychotics, they have a reduction in their symptoms. Bipolar disease is a disease that affects people's moods. It can be a maniac mood, or sometimes it can be depression. Sometimes they are overly happy, and sometimes they are very sad and they prefer to be alone. So some people use both pharmacological and therapeutic means to treat bipolar disorder. Bipolar disorder can be treated using complementary therapy, like telling the patient to go to do some aerobic exercise, um, meditation, yoga, and the patient can also be treated in using spiritual means, maybe by prayers from support groups. The insurance cost of treating mental illness is different from one person to the other. Sometimes it is expensive based on the severity of the mental illness. However, there is a law that passed in 1999. The law is the Mental Health Equitable Treatment Act, and this made provision for private insurance to include people with severe mental illness in their insurance plan. This will allow people with depression, bipolar disorder, schizophrenia, and other mental disorders to have access to antipsychotics, and in a very cost-effective way, so that their treatment do not break the bank. In 1999, Senators Pete Domenici of New Mexico and Paul Weston of Minnesota introduced the Mental Health Equitable Treatment Act, and this allowed private insurance to provide full parity for the most severe mental illness. And this removed the unequal restrictions for treatment for people suffering from mental illness. Our society stigmatizes people with mental illness, but with the provision of the Mental Health Equitable Treatment Act, people are treated better, and they can seek medical attention at a lower cost. I have 4 scenario questions. Question 1: the 54-year-old patient is likely suffering from Alzheimer's. Question 2: there are 2 types of health risks associated with Alzheimer's, and the patient can face short-term health risks like memory failure, viral infections of the brain, autoimmune reactions, head trauma. The long-term health risks include inability to reason well, inability to process new information, confusion, disorientation, and Alzheimer's patients usually wonder. Sometimes they are unable to talk or walk without assistance. Question 3: the patient is shaken because there are chemical deficiencies and lack of neurochemicals in the brain. The patient is confused because she doesn't know what to do and cannot think right due to the Alzheimer's disease. And this made her to be combative because she's emotionally detached from people around her and her environment. Question 4: since the woman is shouting at the doctors and everyone, we should try to calm her down, get the vitals done on her, do head to toe assessments, and make sure she's cleaned because she's smelling of urine, and she's not properly groomed. Thank you for listening to me. I use the Focus on Pharmacology textbook and the National Association of Mental Illness website to conduct my research. My name is Olusumbo. Thank you for listening. Have a nice day.